Hi, everyone. This is Dr. Diane Hayden, publisher of Natural Nutmeg magazine, and welcome to our weekly podcast where I interview our expert writers and contributors on topics ranging from natural medicine, nutrition, spirituality, green living, and how to live a healthier, more holistic lifestyle. So I am excited to have with me here today Dr. Frank Aieta of West Hartford Naturopathic Medicine. He is a licensed naturopathic physician, a nutritionist, and is certified in acupuncture. He specializes in the treatment of both acute and chronic disease, including Lyme disease, utilizing the most advanced natural therapeutics. He offers a wide range of natural non-toxic treatments, which include acupuncture, spinal manipulation, clinical nutrition, diet and lifestyle counseling, detoxification, pain management, herbal medicine, and natural hormone balancing, and he practices in West Hartford. So thank you so much for being with us today, Dr. Aieta. How are you?
I'm doing well.
Awesome, awesome. So I'm excited because you have a new book out called Taking Back Your Health, which is what we're going to be talking about today.
Yep.
So let's just start with, what was the impetus for you writing this new book?
Sure. So I modeled the book kind of after how I treat my patients. So it's kind of a self-help book per se. In each chapter, I kind of go through some of the things that I do with my patients. So let's go through kind of initial visit, second visit, and follow-ups, what I do in my practice, and then how I presented it in the book. So at my initial visit with all of my patients, obviously I take a good history. I do a physical exam. But if someone is reading the book, I'm not going to be able to do that. They're going to be doing it for themselves. So everyone has their own issues of what they want to correct. So I kind of walk them through the steps that they want to take before implementing a treatment plan, a diet plan, a wellness plan. So in my practice, the big thing that I do is run lab work. Okay. So I tell my patients all the time, listen, I'm listening to your symptoms. We're going to do a physical exam. I have half your story. Okay. I get half your story. The other half of the story is going to come when I run the proper lab testing. And so in the book, I kind of walk the reader through all of the testing that I do with my patients. And I teach them in the book how to interpret that, how to interpret all the lab work. But I also go through, based upon their lab work, what type of wellness plan, from a diet to supplementation to exercise and so forth. So we break it down in that fashion. So each chapter I go through specific lab testing. So the first chapter I go through food testing. So this is a very, very important subject. So I try to run a food sensitivity test on almost every patient that I see. So let me talk a little bit about food sensitivity. So people are aware of food allergies, okay? You put something in your mouth, you get an immediate reaction. And when we talk about food allergies are typically immediate, okay? We think like a peanut allergy. You got kids at school, they have a peanut, they swell up, they can't breathe, their lip swells up or whatever it is, they need an EpiPen. Now, this is more extreme, okay? So I do some testing for food allergies, overt food allergies, but most people, when they come in, if they have a food allergy, they probably know it by that point. They say, oh, I can't have that. I'll end up in the hospital. So a food sensitivity is a little bit different. And a food sensitivity is more of a delayed or cumulative response to a food, okay? Meaning you could eat something in the morning and have a reaction 5 or 6 hours later. Now with a food allergy, overt food allergy, it usually is immediate onset and it affects 3 areas of the body: the skin, respiratory tract, or digestive tract. Now with a food sensitivity, we have an it can affect anywhere in the body. It can affect your nervous system. It can affect your mood. It can affect your joints. And it's usually accompanied by some inflammatory process. So I always like to explain to patients how this happens, okay? So when we eat a food, it goes in our mouth, we chew it up, we break it down, it goes into our stomach, the digestive process is continuing. Then as that food moves into the small intestine, we get further breakdown. And ultimately, all of our food, our macronutrients, our fats, our proteins, and carbohydrates should be broken down to their smallest little parts, okay, before we absorb them in the lower part of our small intestine. Well, if that process doesn't happen appropriately, if someone has maldigestion, they're not breaking the food down to its smallest little parts, as that protein works its way through the digestive tract over hours and sometimes days, as it gets down to that portion where the absorption occurs, if we have large intact proteins at the bottom of our digestive tract where it's supposed to be in small parts, those proteins, if they slip through the cracks and get into the bloodstream, that's how our body will mount an immune response. So the whole process here is when I run this food sensitivity test, it tells me which proteins are slipping through the cracks. So the second question is, why are things slipping through the cracks? Why are these large proteins not breaking down? And why are they slipping through the cracks of our digestive barrier? Because that digestive barrier should be a really tight barrier. It shouldn't be a leaky barrier. So one of the things that can cause a leaky barrier there is, continually eating food that your body is having a hard time digesting. We'll use gluten as an example. Gluten's a big one. I find that gluten sensitivity is rampant in today's day and age, especially in younger people, because they're eating gluten breakfast, lunch, and dinner. Now that gluten particle, that gluten protein, if that's not broken down adequately, and it gets down to that lower part of the small intestine and your gut lining is a little leaky due to overuse of antibiotics, medications, poor diet, that gluten molecule will slip through the cracks, get into the bloodstream, and the body will say, that's not supposed to be here. That's a foreign invader, okay? That's like, going into a pollen storm and breathing in all proteins, pollen proteins, but that's more of an immediate thing. This is more delayed. It takes a while before that protein gets down to the lower part of the small intestine and gets into the bloodstream. Once it's in the bloodstream, the body starts making antibodies to it. And those same antibodies that are attacking that food protein will then elicit a process in the body, an inflammatory process, where white blood cells rush in there and they're trying to get after whatever that insult is on the body. In this case, it's the gluten molecule. It could be an egg protein. It could be any type of protein from the diet. Also, when we're looking at this, the more proteins that show up as the person being sensitive to, we know that there's more of a leakiness in that gut. We call it leaky gut. And there's a whole chapter in my book where I go through the signs and symptoms of leaky gut. And I do a little video that I embedded into the book where I kind of go through exactly what I'm talking about now in regards to this food sensitivity test. So this test is very, very crucial. I find that I need to, if I run this on everyone, it gives me more of their story. I can put someone on the best diet in the world, but is it really individualized? Is it really a great diet for them? So it's not a one size fits all. So that's why one of the reasons why I wrote the book, because most books that are out there they're talking about a specific diet plan, then everyone's got to do this diet. And they may give you certain modifications to the diet based upon you, but this is a true individualized diet plan. So that's why I called the book, the subtitle of the book is, it's Taking Back Your Health Through Individualized Wellness-Based Naturopathic Medicine. So by knowing this information, I'm able to, the person that's reading the book will be able to fine tune their diet more specific to their needs. Okay, this food's causing an inflammatory reaction. Let's get rid of it, okay? Then we go one step further. Then we start running lab testing, okay? The first group of lab tests that I look at revolve around the person's ability to utilize carbohydrates as a fuel source, okay? What's that person's, what I call carbohydrate tolerance, okay? So everyone has a specific tolerance for the amount of carbohydrates that they can burn or utilize in a day. And that hinges upon multiple factors. Number one, it hinges upon that person's genetic predisposition. If that person has a family history of diabetes, they may have a harder time utilizing those carbohydrates. I always give this analogy. I say, in our body, we have billions of cells. And on those cells, there's all these receptor sites, like little keyholes, that insulin, this hormone that allows these keyholes to open and allow glucose to get into that cell to be burned up as an energy source. Now, based on our genetics will dictate how well that key opens up that door. And it also dictates how many of those receptor sites we have on each one of our cells. So we know that people that have a genetic predisposition towards diabetes or obesity, they may have a harder time with that insulin working well at the level of the cell, or they may have less receptor sites. One person may have, let's say, 1,000 receptor sites for insulin. Someone that's genetically predisposed to diabetes may have 500, okay? So they have a harder time utilizing glucose, carbohydrates, starches, and sugar as a primary fuel in their diet.
It's
So
so true, because I think there's people who will say, oh, I can eat tons of
yeah,
pasta and bread and whatever. And then there's other people that will say, and I have friends that say this, I can't even look at a carbohydrate and I gain weight.
you're exactly right. And
Yep.
I have patients in my practice that literally they're so sensitive to carbohydrates that even carbohydrates that are found in vegetables, and
Yep.
green leafy vegetables that don't really have high amounts of carbohydrates, that can have an impact on their blood sugar or their ability to lose weight. So this kind of it goes back to our genetic background. Okay. If our ancestors, let's say, lived through a famine, for a long period of time, like a potato famine or something like that, genetically they've evolved to have a more frugal metabolism, to conserve energy. Okay, that's how they survived as a people. So we have to take that into consideration when we're designing a dietary plan or a supplement plan. So that's the first thing. I'll look at a wide array of tests to see how well that person is utilizing carbohydrates as a fuel. Okay. So one in particular test that I really like to run, that most doctors will run on their patients, but they're looking at it a little bit in the wrong way. This test is just a simple lipid panel, okay? A cholesterol panel. But when I look at a cholesterol panel, most conventional doctors are solely honing in on that total cholesterol. If it's over a certain level, oh, your cholesterol is high, you're gonna have heart disease. We need to put you on a cholesterol drug that's gonna poison your liver's ability to produce cholesterol. I look at it a little differently. When I look at a lipid panel, there's two markers that I actually look at. The first one is triglycerides. Triglycerides are fats in your blood that your body will manufacture when you take in more carbohydrates, starches, or sugar than what your body can utilize in a day. Okay, so this goes back to our carbohydrate tolerance or threshold. So certain people can eat a boatload of carbohydrates. They can burn them up as an energy source. There's hardly any left over to get turned over to a triglyceride. Now, a triglyceride, the fate of a triglyceride is to either be burned as an energy source or stored directly as body fat. So the first thing I see is when I look at a lipid panel, if I see triglycerides well above 100, that tells me that that person's in a state of fat storage, okay? Their body is, they're taking in more carbs than what they can burn, and their liver is trying to process and get rid of it by turning it into a fat that can be stored directly as body fat. So that's the first number that I look at. The next number that I look at is the total cholesterol to HDL ratio. So I like to see this ratio, the lower the better. That's telling me that the dominance of their cholesterol is this HDL cholesterol. So let's talk a little bit about cholesterol. I'm not going to go too deep into it. So there's different markers for cholesterol that we look at. There's LDL and there's HDL. And then there's triglycerides. That's what's in the lipid panel. So an HDL cholesterol, well, let's talk about LDL first. LDL is produced in the liver. And so LDL stands for low density lipoprotein. It's a protein molecule that's carrying basically a bunch of fat in it, okay? Cholesterol. And that cholesterol, it's produced in the liver. It's carried out to our tissues where it's dropped off. And when that cholesterol is dropped off at the tissues, what is it doing? Well, it's used to make things. All of our steroid hormones in the body, estrogen, progesterone, testosterone, cortisol, these are all essential, they're all essential hormones that need cholesterol to be formed in their particular gland, okay? So cholesterol is formed in the liver, it's sent out to, or we get it in our diet. and it's sent out to the tissues. It's dropped off. The cells utilize it. Our body uses cholesterol to make cell membranes. Every cell of our body has a cell membrane, and in that cell membrane is cholesterol. Our brain, 25% of the cholesterol found in our blood goes right to our brain. Okay, so our brain is like a big ball of fat. Our nerve cells, the nerve sheaths, they're all cholesterol rich. So cholesterol is pretty important. So once the cholesterol is dropped off there, if there's any that's left over, the liver then produces a cholesterol molecule called HDL, high density lipoprotein. I equate it to like a bus with not a lot of people on it. It's being sent from the station out to the tissues to pick up any excess cholesterol that's not being used and bring it back to the liver to be recirculated, to be reused. That's how crucial, that's how important cholesterol is. It's not this demon that people make it out to be. And so without cholesterol, we wouldn't make it too far. Cholesterol also serves as an antioxidant in the body. It serves to quench free radicals. We need it to heal things, okay? So pretty big deal. So I know I got off track a little bit, but I'm getting back to the whole carbohydrate thing. So when we take in too many carbohydrates in our diet, our body will turn some of that excess carbohydrate sugar over to triglycerides, but also over to cholesterol. And typically the cholesterol that's formed from carbohydrates are small little dense particles of cholesterol that have greater likelihood of becoming damaged or oxidized or becoming unusable, okay? And those are the cholesterol particles that are more problematic, that tend to get lodged in the artery wall. So the cholesterol that's found in our blood that comes from food, like eating a whole egg or grass-fed meats or wild-caught fish, this type of cholesterol is typically more large and buoyant, which is more protective, and the body can utilize it more to make structural components, okay? So when we look at carbohydrates, carbohydrates are one of the leading causes of heart disease, excessive carbohydrates in the diet. So that's what we should be really focusing on. So that's why I look at these groups of lab tests that gear more towards how our body's utilizing these carbohydrates. I look at morning glucose levels. Simple test, every doctor's running it, you know. If that glucose level is above 100, we know that person's having a little bit of an issue with blood sugar management. We also do a test called a hemoglobin A1C. This is a 3-month average of blood sugar. This is a fantastic test. One of the most important tests that I will run on a patient, because it gives me an idea of how well their body is utilizing glucose as a fuel. So essentially what happens is that every 3 months, our body makes new red blood cells. In that period of 3 months, a percentage of those red blood cells will become caramelized based upon how much sugar comes in contact with the proteins, which are red blood cells. Under the heat of the body, 98.6, when that sugar comes in contact with the protein, a caramelization effect occurs. And I use the analogy of creme brulee, okay? You know, everyone knows what creme brulee is. Creme brulee is a custard, a protein. We add a sugar to it, and then we apply heat. What happens? It caramelizes, it hardens, okay? So the higher the blood sugar, that blood sugar, when it comes in contact with proteins, not just the red blood cells, but our nerve cells, our kidney cells, that caramelization effect can occur. So this hemoglobin A1C really kind of gives us an idea of how our cells are aging overall. So it's a really important test. Most doctors are just simply looking at it to monitor patients, you know, that have diabetes or whatnot. And so in my opinion, when I look at that, when I see elevated triglyceride levels, I see elevated morning blood sugar levels, and I see an elevation in this hemoglobin A1C, I know that person's taking in more carbohydrates than what their body can utilize or burn. And so from there, that's how I will devise a treatment plan. And I make it very, very simple from a dietary standpoint. I base it primarily upon the amount of carbohydrates, total carbohydrates. In the past, I would go do more what are called net carbs, where they subtract the fiber from the total carbohydrates, and that was your net carbs. I found that was a little too hard for people to do. It was just one more extra step. So now, based upon what their health needs are, what their lab work looks like, I will kind of give them 3 different plans to follow based upon their daily amount of carbohydrates. It's very, very simple. So people are like, how do I figure out how many carbs are in things? So that's even easier. You just, if you're eating something from a box, a bag, a can, or a jar, you flip it over, you read the label, it says total carbs. That's all you have to look at.
And you want to
And
limit that anyway.
you want
A
to limit
box, a
that,
bag, a jar,
anything
right?
from
Like,
exactly.
and pretty much the other thing, you know, like when we think about whole foods, meats, proteins,
It's not in a box,
obviously,
bag, or a jar.
right. Most of those things, with the exception of fruits, are not going to be very high in carbohydrates anyway. So,
You're exactly
but
right. And then the other thing is like, so if you're not eating something from a box, a bag, a jar, or a can, you have a phone. Pick up your phone.
oh, it's easy. Yeah.
It's easy. You can
To
ask
just
your
look it up.
phone and say, how many carbohydrates are in a bowl of rice? And I do this in my office. I pick up my phone, I ask my phone, I say, how many carbohydrates are in a small bowl of rice? 81 grams of total carbohydrates. That's a lot of carbohydrates in a little small bowl of rice. Now, do you plan on running a marathon after that to burn up all those carbohydrates? Most people are going to say no. So that's excessive. And so what happens to those excessive carbohydrates? They get converted in the body over to triglycerides and small little dense particles of cholesterol, and then ultimately get stored as body fat, or they can wreak havoc from a cardiovascular standpoint. So that's the first area that I look at. The next area, when we're talking about how well someone's metabolism's working and whatnot, is I look at how well their furnace is running. Okay, so we have the genetics, obviously. Okay, that dictates a lot. Do you have a family history of diabetes? That makes you more stringent in terms of what you can tolerate. The next is, how is your metabolism working? So
Oh, can I just interject for one
okay,
quick question? When you mentioned family history of diabetes,
yeah.
the difference between someone who has a parent or some close family member with type 1 versus type 2, does it not matter, or is there
No,
any
it's
difference
more,
there?
it's what I find is it's more of the type 2 diabetic in the family opposed to the type 1. Type 2 is more of this insulin resistance
Right.
situation where their cells are just overloaded. There's not enough receptor sites, or they have this insulin resistance situation going on. And that's more of the genetic predisposition. Now, type 1 diabetes is a little different. That's more of an autoimmune issue
Right.
that develops when they're younger, and their body makes antibodies to the cells that produce insulin in our pancreas. And over time, it gets destroyed. There's also a type of diabetes that's more of, like, I call it a diabetes 1.5. It's called latent autoimmune diabetes of the adult. This is more of a slower process that it develops as people age, and their body destroys their pancreas slowly. It's not like that immediate type of thing when they're young.
Hmm.
It's a huge autoimmune attack on the pancreas. So when I'm talking about genetic predisposition, I'm talking a little bit more, because those autoimmune type of diabetes, that's a whole different type of thing that I'll look
Sure.
at with patients. And
Yeah.
that's where looking at those food sensitivities comes more into play. Because remember, when those proteins from the foods are slipping through the cracks, getting into the bloodstream, and our body's making antibodies to those proteins, in certain individuals, if they're predisposed to autoimmunity, the same antibodies that are attacking those proteins will go after the cells that are in the pancreas, or after your thyroid, or after your joints. These are autoimmune diseases. Okay, so that's a whole different situation. So I will treat that as well. But getting back to the whole genetic predisposition of type 2 diabetes or insulin resistance. So we have that component, but we also have, how well is that furnace working inside of each of our cells? How is our gas pedal working? And that's our thyroid gland. Okay, our thyroid, little gland in the neck here, butterfly-shaped gland, that produces hormones that regulate the rate at which our cells utilize calories that we take in from our diet. Okay, and this thyroid can be a little finicky. Okay, it can be a little finicky with certain people. Certain people can develop autoimmune diseases that attack the thyroid, making that thyroid not as efficient in producing enough thyroid hormone. Or their thyroid can be a little sluggish because maybe they're lacking specific nutrients that thyroid gland needs to produce certain hormones, thyroid hormones. Maybe that person is under chronic stress. And if they're under chronic stress, and that's where we get into the next group of testing, where I look at the adrenal glands and how our body is producing hormones that help us deal with stress. So throughout the book, I break it down and I look at all these individual markers, just basic markers that most conventional doctors can run for their patient. You just have to ask them. And then in the book, I also talk about ways that you can kind of get around that. If your doctor's not willing to run specific tests, there's websites that you can go to purchase lab testing and so forth. So those are the first few things that I look at. And then I get even deeper in the book. Before I implement a diet plan, I start looking at hormones, male and female hormones. You know, if their hormones are imbalanced, that can impact their body's ability to burn calories, carbohydrates, starches in their body. So each chapter goes through each individual testing that I recommend to patients. And then based upon the person's levels, I give an interpretation guide in the book. So if I give my ideal ranges, okay? So you can't just look at the reference ranges that the laboratory gives. And I talk extensively about that. And so I came up with my own reference ranges after close to 20 years in practice and actually looking at the research out there. Mine are more based on wellness ranges, not necessarily disease-based ranges. So when we look at a range, let's use B12, for example. I talk about specific nutrient levels too throughout the book. So let's use B12 as an example. When you run B12 levels through your conventional lab, the reference range goes from 200 to 1100. Okay, it's a pretty broad reference range, 200 to 1100. So people always ask me, why is it so big? Why is the range so big? And what if you're over at the low end, or, how do you interpret this? So the reference ranges are based upon statistical ranges. They're not necessarily based on wellness range. So how do they come up with it? Well, each laboratory has different ranges, and it's based upon the population of people that have actually gone to the lab. So let's say they may take the last 1,000 patients that are so-called healthy, and they clock their B12 levels. And so we have a wider range of B12 levels based upon the population. And they find, okay, so they look at these numbers, they plot it on a graph, and they make a bell-shaped curve. And so if you fall within this bell-shaped curve, and how do they come up with that? Well, they come up with the mean, the average, right in the middle. And they go 2 standard deviations to the right, 2 to the left. They make a bell-shaped curve. And if you fall within that range, you're considered normal in comparison to people in this age demographic and so forth. Now, the problem with that is that, first of all, what constitutes a healthy person from their standards, okay? How are they vetting these people? What makes these people healthy compared to, is it the absence of symptoms? I don't know what they're using for criteria. The problem with this is that you're comparing yourself essentially to a population of sick people. And so I try to compare my patients to wellness ranges. Now, one of the interesting things is that based on the research, if your B12 levels fall below 400, now remember the reference range the lab gives is 200 to 1100, it's been shown in the research that 10 to 15% of patients with levels below 400 with B12 may experience neuropsychiatric or hematological abnormalities. What does that mean? It means neuropsychiatric means anxiety, depression, memory loss, numbness, tingling, hands and feet. Hematological abnormalities means changes in the size and shape of your red blood cells. So why wouldn't they start the reference range at 400 if 10 to 15% of patients below that may experience this? Well, because it's not based on this average, okay? In my opinion, my reference ranges that I think are optimal start at 800 and can go up as high as 2,000, okay? And how do I come up with these? Well, it's all based upon what I've seen clinically over the years. And then if you look at other populations, maybe healthier populations, like in Europe, in certain European countries, that reference range may start at 800. okay? Because they're maybe testing a healthier group of people. I know in China, in Japan, the reference range starts a heck of a lot higher than it does here. And so that's just an example of how we go through each and every test, and I give my reference ranges in contrast, and I explain in the book specifically why I chose those particular reference ranges, you know? And so that's one of the problems that I see in conventional medicine, that, you know, when I'm tightening up these reference ranges, we're looking more for functional problems. Yes, we're looking for overt pathology and disease, but we're looking at what a functional problem is when a person presents with a variety of signs and symptoms. Let's use, in my book, I use this analogy. Let's use irritable bowel syndrome as a example of a more functional problem. Irritable bowel syndrome is a garbage can diagnosis for this person has these symptoms, and we don't know why they have these symptoms, and they don't have, let's say, Crohn's disease or ulcerative colitis, which is an overt pathology. They may have some constipation, they may have some loose stools, they may have some gas, they may have some bloating. They're functional problems. They haven't progressed to an overt pathology. So in conventional medicine, 9 times out of 10, they will offer a treatment that is more palliative, meaning that it's just going to address the signs and symptoms because it hasn't progressed to an overt pathology. And so this is disease-based medicine in conventional medicine. So they're waiting, they're just kind of biding their time. Okay, you have these symptoms. Okay, you have a headache, you have, you know, PMS symptoms, you have this. Let's just treat the symptom opposed to addressing the underlying cause. Because why don't they address the underlying cause? Well, it takes some time to really investigate. And 9 times out of 10, these functional problems are not due to a lack of a drug deficiency. They're due to dietary shortcomings, nutrient deficiencies, hormonal imbalances, maybe an underlying infection or a viral infection, bacterial infection, a structural imbalance. It could be any of these things, a wide array of these things. So
which you're not going to find out in a 15-minute traditional medical exam.
Absolutely not. So that's why I in the book, I go through each individual testing that people are going to go through to uncover maybe what the root cause is. Is it a dietary issue? You know, is it a nutrient deficiency? We're going to find out. Is it a hormonal imbalance? Is it a thyroid condition? Is it an adrenal problem? Is it too many carbohydrates in the diet? So that's what we look at when we go through each and every test in the book. So at the end, after the person has kind of read through the book and run the proper lab testing, they have a solution, okay? This is not a replacement for going to see your doctor to rule out any overt pathology or disease. But if you go to your doctor and they say you don't have an overt disease, you have just symptoms, we're just going to mask those symptoms with this drug, and you want to look beyond that, that's where this book falls into place, okay? Taking back your health, okay? So you take it into your own hands. Yes, I'm not saying don't go to your conventional doctor to get worked up for, you know, you have migraine headaches, and, you know, what's the cause? Do you have a tumor? Do you have, you know, so we want to rule out the overt disease or pathology, which I do in my practice. But also, if I'm not finding that overt disease or pathology, you don't just stop there. You don't just say, okay, well, you don't have cancer, you don't have, you don't have ulcerative colitis, you don't have an autoimmune disease, but you got these symptoms. So here's a drug, take this for the rest of your life, and it'll alleviate your symptoms. And come back when it stops working or something new crops up or whatever. The problem with this is that when we palliate symptoms, it's like, I use the analogy, it's like you're driving down the street and a building is burning, okay? And instead of putting out the fire, you smash the fire alarm and keep going, okay? That's what a Band-Aid approach is to medicine. And unfortunately, that's what we're seeing quite often in conventional medicine, managed care, where the doctors allotted only a certain amount of time, and all they're looking for is that, okay, do you have cancer or not? Do you have this disease or not? Yes or no? And if you do have it, okay, we're gonna bring out the big guns. We're gonna do some surgery. We're gonna do some heavy duty drugs, and we're gonna go from there. And then once we take care of it, we're gonna send you on your way. If you get something else, you come back to us. There's like really no follow up. There's no wellness to that, So it's a disease-based model system, which in the long run doesn't really cut the mustard. I mean, and that's what I see primarily in my practice. I see patients that have gone to 5, 6, 10 different specialists or, experts in the field. They come to me and say, listen, I've been to all these doctors. I'm taking a boatload of medications. I don't feel healthier. In fact, I feel sicker. And I still have some of these symptoms, and if I stop this medication, it comes back with a vengeance. And so that's where naturopathic medicine kind of gets fit into this whole mold here, where we start looking for those gray areas, more functional problems. And 9 times out of 10, once we find the root cause of it and we address it, there's an alleviation of those symptoms. Now, one of the big things about naturopathic medicine, and I kind of talk to my patients about this all the time, is that it's not a quick fix. I can do things to obviously palliate your symptoms, and I do that all the time, but obviously in the background, we're working at addressing the root cause. Let's say someone comes into my office, they're extremely overweight, their diet's garbage, they're not exercising, and they have high blood pressure, okay? Ideally, to get that blood pressure normalized, we got to get them to lose weight. We got to get them exercising. We got to get, there's a bunch of different things that we need to go into that treatment. So they may come in to see me on 2, 3, 4 different blood pressure medications or whatever it may be. I'm not going to say get off all those medications. I'm going to say you stay on those medications for now. And in the background, we're going to teach you good lifestyle skills. We're going to run some other lab work and see what the root cause is of your blood pressure. And as your blood pressure improves, you're going to gradually reduce the dosages over time, okay? If a patient comes in and they have kind of moderately high blood pressure, they're not on any drugs, I may use an herb opposed to a drug to temporarily bring that blood pressure down. We're not done there, okay? We're not going to just say, okay, Diane, you have high blood pressure. Here's an herb opposed to using the drug. Now, the herb is better than using the drug 9 times out of 10 because it carries less side effects, more works with the body opposed to against it. But it's not the solution long term, okay? We're going to put them on that maybe for a short period of time while we're doing all the good work in the background. Now, what if that person doesn't want to really change their diet? What if that person doesn't want to exercise? So it kind of comes down to, okay, so maybe they're going to have to stay on that herb a little bit longer, or maybe if that herb's not cutting mustard, maybe then they maybe need to go on a medication. So I tell patients, it's just as good as you want to feel, okay? I have patients all along that whole spectrum. I have patients that want to do everything I tell them, and they want to get off every medication. They want to have everything working properly and just want to do everything natural, and they follow my regimen to a T, and they do great. And I have people that want to do it 50% of the time. They want to be able to, do what they want for most of the time and kind of, just watch it a little bit. I say, okay, no problem. It's better than doing it 0% of the time. So if you can do it 50% of the time, that's great. You may need to be on certain medications along with doing what I'm telling you because, you're not holding up your end of the bargain, So a person may come in with high blood sugar, and they went from eating 500 grams of carbohydrates a day down to 300. Well, they really need to be down around 50, okay? But they can't really do it. So I say, okay, it's better than the 500. You'll probably be able to reduce some of your medications. We'll do some things on my end, some supplements, some herbs and things like that, in conjunction with you doing your diet 50% of the time. And you'll probably get yourself to a better level of health, better than where you were originally. You're not going to be ideal. You'll still possibly be a diabetic or whatever it may be, okay? So that's one of the things that I like to clarify to people, even people that are reading the book, it's like I said, you're taking back your health, and to what degree you take it back is entirely up to you. Exactly. Entirely up to you. So, and that's why, and I've made the book really user-friendly. I've kind of taken taken the mystery out of it. I say, from a dietary perspective, a lot of it hinges upon the amount of carbohydrates. When you cut back on those carbs, a lot of things change in the body. So I use that as a big focal point in the book. And then kind of going from then obviously removing foods that are problematic, and that comes down to the food sensitivity testing. So it's really basic when you really look at it. It's not rocket science when you really look at the whole picture of what I'm doing here. It's just getting people to start looking at their health in a different manner, opposed to just, I have a symptom, give me something to treat the symptom and leave me alone. Okay. Because ultimately with conventional medicine, when you're treating just the symptom, all you're really doing is translocating that symptom to someplace else. What does that mean? It means that every drug that you take has a side effect, essentially, right? So we know that every drug, even aspirin, every drug has a side effect. So when you're just trying to palliate a symptom, that symptom just changes shape and it pops up someplace else,
Yeah. I mean, unfortunately, the issue is we're in this instant gratification, type of society that we've been living in for a long time. And people are used to just, like, oh, I want it, I want it yesterday. And I tell people, look, you didn't get to this place of poor health overnight. So you're not going to get out of it overnight. It's going to take time. And don't look at it from the perspective of, well, I take a drug and it happens instantaneously. That's not the way that natural medicine or lifestyle changes work. It takes time. But I feel like, just by making some simple changes, people will be surprised at how much of a difference that makes in the way they feel, and in subtle, changes of their lab tests and things like that. And really, it's especially with people who are focused on losing weight. I have learned that, when you get them focused more on changing their lifestyle and focusing on what foods they can eat that they like, then the weight loss is kind of like a byproduct. You don't even have to worry about it, really.
That's exactly it. And that's kind of what I've modeled this book after. It's like, it's not necessarily driving towards, your optimal weight. It's pushing you more towards optimal health and how well you want to feel. And like I said, everyone's an individual. So I can't expect everyone to do everything that I tell them in my practice. Like when I first started practicing, close to 20 years ago, it's like I would get so, I wouldn't understand why people couldn't follow everything that I say. And then I took a step back and I'm saying, I can't follow everything that I say. It's like, what am I doing?
You were like the soup Nazi.
Exactly. So it's like, you have to pick and choose. You have to pick your battles and kind of go through people. And one of the biggest things that I feel that I do with my patients, opposed to conventional doctors, is I provide a lot of encouragement. I focus in on the positive of the progress that they make. I don't come at them and use scare tactics to get them to be compliant. That's what a lot of conventional doctors do, because, they really, the person may be hesitant to do a lot of the stuff that they want to do. So of course, you're going to take this drug, you're going to take it for the rest of your life, and it may cause X, Y, and Z of symptoms, but you got to take it because you could die, or you can and that's kind of their tactic.
Yep.
For me, it's like, okay, we're going to do this and I'm going to check your labs in 3 months, and you're going to come back and we're going to talk about all the symptoms and all the problems that you had at your initial visit. And we're going to check off the list. Okay, do you still have this? Do you still have this? How much better do you feel? How's your sleep? And that's the other thing, is that we're asking questions about more than just their symptoms. We're talking about, how's your energy level? How's your digestion? How's your sleep at night? All these different things that people overlook, that doctors overlook, unless the person overtly comes in with, talking about these things. I ask all these questions because it provides me with information of what's kind of going on underneath, we're peeling away the layers of the onion. And I say it to patients all the time. It's like, the best thing that you can do is, when you come back, is to be a very good reporter, because that's how I listen to you. And you're going to guide me on where we need to go next. The blood work's going to guide me as well to some degree. But once first and foremost, I'm treating you as an individual. I'm not treating lab work. And that's one of the problems that I see in conventional medicine. They're just treating numbers on a page. I look first and foremost at the person's clinical signs and symptoms and ask them a lot of questions. I'll give you a good example. The thyroid, okay? I see more cases of patients being mismanaged with thyroid issues because the doctor is relying solely on a lab test that the reference range is this big, okay? So if a patient comes into a doctor exhibiting a multitude of different symptoms that may say that they may tell the doctor, this person may have a thyroid condition, okay? These are all symptoms that fall under that hypothyroid or hyperthyroid umbrella. They run the blood work. If that person falls within this very large reference range, they say your thyroid's not the problem. Well, how come I can't lose weight? How come I'm tired all the time? How come my skin is dry? How come I'm losing my hair? These are all symptoms of hypothyroid, aren't they? Yes, they are, but your thyroid TSH test is completely normal. And so we're just going to treat each symptom. So let's go through the list. Okay, well, your hair's falling out. Well, here's some minoxidil. Just rub it in and your hair should start growing back. Okay, great. You're overweight, so let's put you on a crash diet, or let's get your calories down to like 500 calories a day and exercise like crazy. Or it's they're treating each individual symptom. Or
instead of thinking that maybe the lab test might be wrong, or
exactly.
like maybe the parameters are just incorrect as far as what the lab is classifying.
Well, most doctors don't do that. They're just looking down the list. They're saying, oh, well, all these things are in range, So that's the first thing that changes once I implement my lab ranges. Okay. All of a sudden now you got the person starts thinking about, oh, well, you're not in the optimal range for thyroid. You're at the low end of the range here. Like, you're just like one tick away from being outside the range. So maybe we should look at this a little bit differently. So that's one of the big things. And I talk about that in the chapter in my book about thyroid. I go through all the lab testing. And by the way, most conventional doctors, if you're lucky, they'll run maybe one or two lab tests for thyroid. In my practice, and I talk about in the book, I run 5, okay? And I look at all each individual numbers, and I take those numbers into consideration with the person's clinical signs and symptoms. You got to look at both. Remember the whole thing about getting half the story. Patient comes into the office, I ask them a slew of questions, I do a physical exam. I still only have half the story. I'm not going to base my prescription on just those clinical signs and symptoms because I don't know what's underlying. And so not only do I run the lab test, but maybe I'll send them for some imaging. Maybe I'll do an ultrasound. Maybe I'll do, so there's other testing that I may choose. Maybe I'll do some more advanced testing. If they have some bowel issues and they've kind of done the dietary thing, well, let's run a comprehensive stool test. Let's see what's kind of going on in their digestive tract. So there's much, much more. It's just not just stopping at, okay, we've eliminated your symptoms. I've done my job. Get out of here. No, it's way beyond that, because that's very simplistic when you think about it. Anyone can write a prescription to treat a symptom. You can teach anyone to do that. You don't really even need to be a doctor to do that. People do it all the time. They self-medicate all the time. They go to the drugstore, they buy, an over-the-counter medication. They medicate themselves with food. They medicate themselves with recreational drugs, with alcohol. So I see that constantly. So, that's one of the big problems that I see over and over and over again. And that's the biggest shortfall in conventional medicine. Believe me, and I say this all the time, I'm not discrediting what conventional doctors do. There's absolutely 100% a need for what they're doing. It's just that when it comes to wellness-based medicine or treating more functional problems, they miss the boat by 100 miles. A lot of times they're trying to treat a functional problem with more of a chronic, they're trying to treat a chronic issue with an acute treatment. Okay, they're just, which needs much, much more. So let's say someone comes in with rheumatoid arthritis. They have swollen joints and hands and stuff like that. The first thing I'm going to look at is something that they're eating in their diet inducing this problem? Is it causing more inflammation? That's where the food test comes into play. Are they lacking a specific nutrient? Do they have an imbalance of their omega-3s to 6 ratio? Are they eating too many inflammatory foods that contain crappy oils? So we'll look at all of these things opposed to someone going into a conventional rheumatologist and saying, okay, we diagnose you have rheumatoid arthritis, this autoimmune disease, your body's attacking your joints. We're going to start off by putting you on a steroid drug like prednisone, which will suppress the immune system, will knock down the inflammation, and you should feel better, okay? But even in conventional medicine, that's not a long-term treatment, okay? That's more of an acute treatment applied to a chronic disease. So they know this at this point. So then they go one step further. They may say, okay, we don't want to keep you on this steroid drug for too much longer because it's probably causing a lot more problems underneath. So we know this. So let's go move over to a drug called like a biologic. Now, a biologic drug is more of a drug that may be immunosuppressive, okay? So we're going to give you a drug that's going to basically suppress your immune system's reaction, and it will subsequently have you stop attacking your joints. Now, in my opinion, what I want to do is I want to identify what's the cause, what's the underlying cause, what's driving the immune system to attack your own tissues. And I have a wide array of things that I'll think about. So number one, I'll say, okay, is there a food that you're eating on a daily basis that's inducing an immune response that's causing you to attack your tissues? Okay, well, we'll run a food test and we'll take you off that food. That's step one. Let's look at the blood test. Are you lacking specific nutrients? Okay, is that causing some dysfunction? Do you have an underlying infection? Maybe you have an infection in your system. Maybe you have Lyme disease. Maybe you have Epstein-Barr virus. Maybe you have something underlying that's causing your immune system to be on heightened alert all the time. Your body's trying to fight something, some stealth pathogen that's in your system that may not be showing up on conventional lab testing. Or it may be showing up, but the doctor says it's not bad enough, you know? So these are the things that I look at when I'm trying to evaluate a chronic situation, always striving to understand what the underlying cause is. And so that's kind of that's the defining line between what I'm doing and what conventional doctors are doing. But if you get hit by a car, if you're having a heart attack, if you're having some acute, don't come to my
Call
office.
911.
Call 911. Go see. They're the best at that. So that's where I think that conventional medicine really, really shines, is in that acute care setting.
Sure.
Okay, where it's like, okay, we know exactly what happened. You know, you got run over by a car. Okay, so we know exactly what the cause of your problem is. Okay, so we're gonna fix you up the best we can. And then we're going to kind of go from there, and we're going to send you to therapy, and we're going to do this. We're going to do a surgery. Fantastic. I'm all for it. But when it comes to more of these other issues, these chronic illnesses that are basically a further progression of a functional problem that left untreated ultimately turn into an overt pathology. So my goal as a naturopathic physician is to kind of catch them in the middle there. Ideally, catch it before it even turns into a functional problem. You know, teach them lifestyle and dietary tips and tricks to prevent them from going into that gray zone and ultimately getting into the overt pathology zone. So that's kind of the whole premise of the book, is to kind of open people's eyes in that regard. And kind of, like I said, take back your health, opposed to get yourself out of this disease-based system. And some people are going to go for it, and some people aren't. You know, it's to each his own. And I don't look down on someone that says, I don't want to do that. I don't want to eat right. I just want to live my life, and I want to take a medication when I don't feel good, and this and that. But ultimately, those people, and I've seen them in my practice, as they grow older, their quality of life diminishes big time, big time. I see it with, I've seen it with family members, where, I'm trying to give them the advice, and then I just back off. I said, okay, no problem. you do what you got to do, and we'll kind of go from there. And
Yeah.
I'll do the best. When you want my help, I'll help you.
That's all you
So
can do.
that's all you can do.
Yeah.
You can, like, the whole old, analogy, you can lead a horse to water, but you can't make him drink. I see that time and time again. And
Yeah.
so, and I can read people, when they come in my office, I can tell what they're kind of willing to do. And each time they come in, I try and introduce a little bit more, kind of nudge them a little bit. But, if they don't want to do it, I back off. I'm not going to be pushy. Listen, I work for them ultimately. And that's what I say, I work for you. I'm going to respect what you're willing to do. Anything's better than nothing. Okay. If you're here, if you're sitting in my office in front of me, something prompted you to come and see me. Maybe your wife dragged you in here and say, get in there and go see this guy, but something prompted them to come in and see me. So I
Right.
take that into consideration. So
Yeah. So you were going to give us a little sneak peek of the book and let
I
people know
am.
how they can order it, and also how they can get in touch with you.
Absolutely. So let's pop up here. Let's share the screen, and we'll pop this up here. And okay, so it's an ebook. Okay, so you're gonna go right to my website, and the link is just draieta.com/ebook. Okay, and you'll be able to download, or if you forget the ebook part, just go draieta.com, draieta.com, and it's right on my homepage there. And then you can click it, and it teaches you how to download it. And you can you view it on a tablet, you can view it on your phone. I'm in the process of turning this from a PDF into an app, actually, that will be on your phone all the time, so you can have access to it. And if you buy the book in this form and you're in my list there, we will automatically send you the app version, so that way you can have it with you all the time. And there's going to be a lot of different features in there. I'm going to put a carb counting feature in there so that you can clock your carbs and everything else. There's going to be real-time updates in there as well. So if I'm changing something or I'm adding something, I'm going to shoot it up there, and you're going to be able to see that immediately. Okay. So this is the book. Okay. So let me go forward here. This is my nice cover here. And I go through, you can see all of the chapters. I have a chapter, why I wrote the book. Obviously, I kind of went through that with you already. Testing for food sensitivities. We have it on thyroid. We have the adrenals, imbalanced female hormones, male hormones, testing for, what tests we would do. I talk about inflammation, testing for viruses, nutrients. So kind of go through each and everything, every topic here. And then as you go along through the book, I've embedded in certain areas little videos. So you can click the video, it will take you to the site, and then you can watch this video. So if you're kind of sick of reading about stuff and you want to take a little break, you click the video, and
That's
then
awesome.
it'll kind of go through. So I talk about kind of what I talked about today in this video. This video, I kind of talk about, individualized wellness-based naturopathic medicine. As we go further, I talk about the food testing here. Here's another little video that I kind of go through and explain the food sensitivity testing more in detail. Then we get into some critical lab tests that everyone should have performed. Little homework before getting your blood work done. This is an interesting part where I've been having, and I do this in my practice, I have patients, initial visit, I go through everything with them. I kind of take their whole history, physical exam, and I say, listen, go get your blood work done. But between now and the next time I see you, I want you to pick 2 days during the week, 1 day on the weekend, and I want you to go through and monitor the amount of total carbohydrates that you're consuming in your diet on a daily basis, okay? And then when you come back and see me in 2 weeks to go over your blood test, I want you to tell me what that number is. Is it 100? Is it 200? Is it 500? Based upon that number, I will then look at your blood work and I'll say, okay, this blood work right here represents you eating this many carbohydrates, okay?
Mm-hmm.
So let's say they're eating 200 grams of carbohydrates a day, and I look at their blood work and I say, your blood sugar's high, your triglycerides are high, all these are showing me that you're taking in way more carbs than what your body can burn. No problem. Let's go from the 200 grams of carbs. Let's get you to 100 and see how you do. And do 100 grams of carbohydrates a day, kind of clock all that. And then in 3 months, when we run the blood work, let's see where your levels are. Wow, the levels are so much better. Or they're better, but you can still do a little bit more. Let's go down to 50. So we can do a gradual step down method. So someone may not need to be on like a full-blown low-carb ketogenic diet. They may need to just tweak it a little bit. So let's say someone comes in, they don't have much going on. They're just looking for optimal health, and their blood sugar, everything looks really good. They come back and say, listen, I'm doing 200 grams of carbohydrates. I'm doing this much exercise. I say, you know what? 200 grams of carbohydrates is good for you. So continue doing what you're doing, because I'm not seeing anything in your lab work. I'm not seeing anything in what you've told me that's telling me that you're eating way more carbohydrates than what you can utilize, okay? And they're happy to hear that. But maybe you want to do X, Y, and Z from a supplement perspective, or maybe you want to kind of shuffle in maybe a little bit more of these foods, or maybe you want to take out these foods because that showed up as being inflammatory or sensitive. So that's an interesting part. So that's that little section here, which is some homework before getting your lab work done. So I go through that in detail. So then this whole section here, I kind of go through all the testing that I will do as far as looking for your body's ability to utilize carbohydrates. We have the fasting insulin, the hemoglobin A1C that we talk about, that caramelization effect, the fasting glucose. We got our lipid panel here. Then I kind of give you a whole breakdown, some of the important facts about cholesterol. We talked about that. Cholesterol's manufactured in the body, and it makes up all the hormones in our body. So I kind of put people's mind at ease regarding their cholesterol levels. 9 times out of 10, when you go to a conventional doctor, they're basing your overall health on that simple number of cholesterol. Oh, your cholesterol is perfect. You're in perfect health. But I don't feel like I'm in perfect health. What are you talking about? Well, that's all we ran on you. And so that's all we can go by, because I see it all the time. Conventional doctors will just run rudimentary testing, but they're not going any further. And so they're basing a person's health on just a couple factors. Oh yeah, your blood pressure is good and your cholesterol is good, so you're in good shape. Okay, well, what about all the rest of the things that we're looking at? What about all these symptoms that I'm having? Well, we're not seeing any overt disease here, so we'll just treat those symptoms with a palliative treatment, okay? Once again, that's where we're kind of missing the boat. So we go a little bit further, we go into the whole thyroid portion. This right here in the bottom right corner are your clinical signs and symptoms of thyroid, low thyroid function. So not only are we looking at the blood tests, we're looking at the clinical signs and symptoms. So if you're exhibiting a multitude of these symptoms, you may have a low thyroid function. Your furnace is not working as well as it should be. Then we go a little bit further. I go through the testing on adrenal glands. I give a nice case study over here on the right-hand side. We give the follow-up. Then we get into the whole female hormones and so forth. We get into the blood testing. We get into some of the male hormones. We talk extensively about inflammation in the body. We talk about checking for specific viral infections. Then we get into the whole section about vitamins and minerals. We can actually test for a multitude of different vitamins and minerals through just conventional blood testing. We're talking about going to Quest Diagnostics, LabCorp. We can run all this stuff. 9 times out of 10, this will be covered entirely by your insurance. You just need a doctor to run it for you. And I talk about it in the book. If your doctor won't run it, there's places that you can go on the internet where you can get 90% off the retail, and you can run all these tests yourself. You can plug them into my whole breakdown here. It will tell you where you reside in terms of wellness. Where are you? Where's your ultimate health? And one of the things that I do with a lot of times with my patients say, well, what do you think? I said, you want me to give you a grade? They say, yeah, give me a grade, based upon what you're seeing. I say, F to A, so I'll take it all into consideration. I give them a grade. They like that, and then as they improve, we improve their grade, So I say, yeah, you're around a B plus. They say, I want to get to an A. I said, okay, well, this is what you want to do. Or I may say you're at a B plus. They say, I'm content with that. I don't want to do, I'm good. You know, if you can fix these few things, I'll be happy. We go through. Now, this is a whole section here. I talk about brain chemistry. So balancing out your brain chemistry. I do a little video here where I kind of get more involved, and I talk about some questionnaires that we can take, to figure out, so I'm not able to ask the people reading this book these questions, but I included a bunch of different questionnaires in here. So based upon how they answer the questionnaire, that will kind of push them in the right direction of what they need to do. So if there's imbalances in brain chemistry, they can figure it out just by looking at some of these questionnaires. I also include a questionnaire on adrenal health. So if someone has some adrenal issues, if they take my quiz, it will tell me to what degree their adrenal glands, the glands that helps their body deal with stress, may be working. Okay, is it working great, or is it not working so good? I kind of go through the whole thing. Then I kind of get into the dietary section here. Diet plan 1, diet plan 2, diet plan 3, all based upon, your individualized needs. So for example, I'll just read this for you. Dietary plan 1, you're a type 2 diabetic, you have cardiovascular disease or any other chronic illness, you lead a sedentary lifestyle and need to lose more than 15 pounds to be at your ideal body weight composition. You have all or any combination of the following blood results: leptin levels above 10, hemoglobin A1C above 5.7. So I kind of go through the whole thing. I say your daily intake of total carbohydrates should be less than 50 grams, split evenly amongst your 3 daily meals. Try not to exceed 15 to 17 grams per meal. So this is individualized. So based upon where they are, based upon where their levels are, what their needs are, this is the dietary plan that I'd like them to follow for the next 3 months before they recheck their labs. And then based upon that, where they are, then they maybe can move to the dietary plan 2 or dietary plan 3, whatever they want to do. If this is too aggressive for them, I'd say, listen, no problem. Let's start at dietary plan 3 and then do that for a little bit and then ease into 2 and then maybe down to 1, individualized. Not everyone's going to go hardcore into this first dietary plan. They may want to ease into it. Maybe their symptoms are not so pressing that they need to get rid of them yesterday. Maybe they've been living with stuff for a little while and they're just mild symptoms. So as we go through the book, I kind of I break it down. Which carbohydrates are good? Which ones are bad? Okay. We go through a little bit further. I break it down into a little table here, even down to vegetables. Certain vegetables are better than others based upon their carbohydrate content, and we kind of go through a little bit more. I talk extensively about leaky gut, which we talked about earlier. Mm-hmm. We'll go down a little bit more. I talk about some supplements, some dietary supplements that if you think that you have some leaky gut, these are some some supplements that you may want to try taking and see if you get a elimination of your symptoms. Okay. I'd rather see someone try a couple supplements that aren't going to hurt them opposed to jumping headfirst into some drug that's just going to palliate their symptoms, individualing your dietary supplement plan. So based upon your blood levels of certain things, I have a nice chart here. So if your fasting insulin levels are greater than 5, here's a couple supplements here that I would recommend. You click the link, it takes you to my webpage. Okay. So that's kind of it in a nutshell. We've gotten already down to, 108 pages here.
Yeah.
We got the got the conclusion, and I always say, if you like the book, leave me a review. Okay?
That's awesome. Yeah. I mean, I love the fact that it's an ebook, especially now, because if people are just concerned about still going out or whatever, you can order it and read it from the comfort of your own home, or
yeah, absolutely.
And then people can get a taste for you and the way that you practice. And sometimes I think, people like to read things. I mean, I hear that all the time from our magazine. Like, people love the fact that they can read an article and, it gives them an insight into who the practitioner is. And this way they can learn more about you and, the way that you practice and all that. So that's awesome.
Yeah. So I think it's, it took me a while to kind of put everything together and make it exactly how I wanted it. And I like the videos in there. And so the big thing about when I put it into an app form, when people download the book, they're going to get both forms. They're going to get the PDF form, and then ultimately they'll get the app form where they can have it on their phone. They can have easy access to it. Like, let me check, about this or that, and they can look in there and they can track their progress as well. Ultimately, I want to turn this into an audio book too. People always ask me, why don't you make it into a hardcover book? I think it will lose a lot of what I'm trying to do with it if I do put it into a hardcover book, because then you don't have that interactive experience with it. You don't have the hyperlinks, you don't have the videos and so forth. I had someone just the other day who downloaded the book, and they came in and they printed out the whole thing. They had this big stack of photocopy, and they're like,
some people just
perfect.
like paper.
They just like to have it. They highlighted it. They put all this. I said, beautiful. That's perfect. Right. I go, so now you have it, the digital copy, you have the hard copy, and ultimately you'll have me reading the book to you, so that there's no way that you haven't really gotten a chance to look at it. So, a lot of people like that. And that's why I included a lot of the videos in there to really express my points on certain things, because it can get a little dry. And the way that I wrote the book, I made it really user friendly in terms of putting a lot of things in layman's terms. When we're talking about blood work, it gets scientific, but I break it down just like how I'm explaining it now. I use a lot of analogies. I use a lot of case studies to make it user friendly, because what good is it if you just download it and leave it on your laptop? It's, and you never access it. Right. And that's one of the reasons why I want to make it more interactive. And ultimately, when it's interactive with the app, I want to build kind of a community with that app. And so people that have the app, they're able to kind of converse with other people in a community type of setting, and they can ask questions to a bigger, larger group. And so that's where it kind of builds from there. So people always do better when they're in when they're in a community-based type of situation. We see that with Weight Watchers. One of the reasons why that's successful, it's not a great dietary plan, but it holds you accountable. You're in with people with a group, and you can kind of bounce ideas off each other with like-minded people. So that's where I plan on going.
Basically.
Yeah, it's a support system.
People need that.
Yeah, not only from a weight loss perspective, but just an overall wellness perspective. Like, people love to hear how other people are doing following a certain plan. Like, what type of results have you gotten doing X, Y, and Z? Totally. I've gotten this type of results, or I've gotten that type of results. So people like that. People really, really like that. So that's kind of where I want to go with all of this, Yep. And I think that the other reasons why this book was important to me to do is because for my patients, okay, people that are already working with me, it's a resource for them to kind of go back to, after, they're with me for, let's say, a half hour, 45 minutes, an hour. Well, after they leave me, I don't want them to forget everything that I explained to them. I want them to have a resource to go back to. And if they don't feel like reading, they can watch a little video on it and so forth. So
that's great.
Yeah.
Awesome. Well, this has been fantastic. I'm sure people who are listening to this will be interested and wanting to learn more. So they can go to draieta.com/ebook, or just draieta.com if they want to reach out to you personally and book an appointment to see you. And you're doing things virtually now, so people can really see you from anywhere.
I'm an expert at Zoom,
Yeah, so that's awesome.
So this is awesome. Half of my patients will come in and see me. The other half, they may want to still do it. They find it's more convenient, or they just still afraid to go out maybe, and be out in public too much. And so I take every precaution when patients come in to see me, but at the same time, if they want to do it from the comfort of their own home, I love doing these. They're great, So it's nice because I can share my screen. I can show them their lab work in real time. I can show, okay, this is what your lab work looks like. And then I can just email them a copy of it. So
that's awesome.
It's good. It's been great.
Yeah. And we have people outside of Connecticut too. So
absolutely. Yeah.
Yeah. So this podcast will be e-blasted out to everybody, and it lives on our website, naturalnutmeg.com, and you'll get a copy as well. Beautiful. And thanks everybody for being with us. And thanks again, Dr. Aieta, for all the great information.
Thanks for having me. I appreciate it.
Awesome. Have a great night, everybody.